Thank you all for
these kind of things. There is also a lot of issue regarding, I don't know how to measure the well-being. It's something, we have a lot of scale, we have a lot of different things like that, but every time we put it at the end in boxes, it's very difficult for, I would like to be able to, when I informatize the process, to be able to take into consideration this nuance and this kind of thing was very hard. But, I need to, sorry. And
you need to also be able, actually, like, your beneficiaries also need to be able to evaluate your case management process, which also doesn't happen really so often.
So all the questions regarding the biases that you already discussed, how it's possible to use a mobile phone when you are doing an assessment with a child. The issue regarding training or skill or the skill of the social worker. So if I need to rush a little bit. No, I moved too fast.
Oh, your fault, Janis.
Okay. How to avoid that we are going to a too quantitative or too statistical approach of social work or a too administrative approach. It's something that I really see in the field that, we are just respecting the process and nobody's going a little bit beyond of what is written. And how regarding most of the protection issue, we are working in country where there is no legislation or it's not implemented, there is no, or it's very powerless regulatory body, and you have no organization which are representing the final user or the social worker. So there is no really counter power regarding the tools that you are currently implementing. It's something I think it's very dangerous. And how to take into consideration the final user perspective. So I just put some ideas how to move forward regarding this question. So one of the solutions that we discussed with Terre, it was to develop a readiness tools that we already discussed with UNICEF, and we are in the process to link the different initiatives which are regarding this topic. So to be sure that before that we implemented a digital system that people have, it's in the right context. So of course to check donor harm issue. I don't know if you are implementing in a country such a tool where policy could have access to the system. It could be a big issue. To be sure that social worker understand what is case management, they are properly trained, they have ICT literacy and all this kind of things. So to avoid that the system that we put in place is not answering the need and it's creating more troubles than solution. I have also the feeling that we should very take care of that social workers are still involved in the development of their tools. I have the feeling that most of the time, especially on the field, that people feel dominated by the technology and say, okay, this is a system, how it works, I cannot change it, I can improve it. And I think it's very important that social worker keep the control of that tool and not me.
We really have to stop because ours are finished, we don't have a break now. So we need to change the setup of the room before the workshop.
Sorry, Edmond, one last sentence to conclude.
No, but for me, it's just to avoid that the tool is not an end at itself, of course, but it's just to support the social work.
Okay. Well, thank you all, and perhaps during the pause a bit later on, if a few of you want to get together to continue and ask a few questions to our speaker beyond the questions that there have already been, feel free. Thank you. Thank you.
So no break now, we go directly. Sorry.
Sorry, Edmond.
In partnership with UNHCR and the ICRC, which is also a very interesting partnership between these big agencies, decided to do this joint research. It was funded by DFID, and they contracted mHelp, Health Enabled, to undertake this research project, and had 3 phases. A desk research, so really to see look at all the information available. They did also field research in South Sudan and in Kenya, and a 3rd phase where they put all the findings together of the research and made the analysis and the recommendations, etc. So the main research question of this study is, does the digitization of child protection case management in emergencies contribute to improved outcomes in terms of reducing vulnerabilities of children by improving factors such as time efficiency, work efficiency, child friendliness, and the ability to track children across case management systems? So that was a very broad research question that this research tried to answer. I just wanted to quickly, I wanted to mention the limitations also of this research. Just a few quick points. So I did not investigate, did not go into any laws on data protection and data sharing. And it was mainly for refugee and IDP settings. So it was not a research that was done in for example, a post-natural disaster. And the research relied also heavily on qualitative data. So to get to the findings of this research, so the main finding was that there is in literature a very limited evidence base for the impact of the use of ICT. So it really did not permit to reach a definitive conclusion. However, what this research did was make not only an ICT framework, so really something that programs can use to understand how and when to use ICT in their programming, but also they build actually a very interesting theory of change to really come to the outcome of reducing vulnerabilities of children in emergency settings. That can be interesting for future evaluations. So this research really provided a basis for further research into the subject. Another finding was that the investments have focused mainly on data management solutions and reducing time-consuming administration processes. But for example, making the ICT systems more child-friendly or related to all the different activities in case management was not so much done. The system that were observed also had a strong focus on FTR, with a particular attention to registration. And another finding was that data sharing enhances coordination and collaboration across agencies. But this is, if it's digital or not, both of course that will have an impact on both. And the data will be transmitted faster than on paper. You can also interrupt me at any time, by the way. If you have any questions or anything you would like to ask, please don't hesitate. So I thought it was important also to mention just the major barriers to moving to let's say digital case management. It's not only a barrier to move to digital case management, but also a barrier in the actual implementation. One was the lack of interoperability. So when you have big systems, like for example, the CPIMS and Progress, if the data cannot be shared easily between the two systems, that's something that hampers also implementation. A lot related to concerns on confidentiality and data management. I think around that a lot is also related to a lack of information, but this was still a major concern that was, and something that really need to work on now is to make sure that we understand what all these risks are for confidentiality and to make sure that people actually have the appropriate information. Then the speed provided by CT to the child protection case management in emergencies also risks sacrificing quality of information collected. There was a main, really the main obstacle is technostructure limitations, so a lack of technical, how you say it, IT enabling environment, lack of connectivity, and lack of also people with the appropriate knowledge to put these systems in place. And another major barrier is high staff turnover and loss of institutional memory. We see it all the time that people are using certain systems, but then there's so much turnover of staff that in the end people don't know how to use the systems anymore. So this is also an important finding. The main recommendations of this research, one is of course to conduct further collaborative and cross-agency research to evaluate the impact, and really to look at in this theory of change that's proposed in this research, really the end result has to be how to use ICT really to reduce vulnerabilities of children through making systems more time efficient, etc. So it's really about in all the ongoing actions now and the concrete work we are doing, we have to make sure that we have an appropriate baseline and to make these evaluations very concrete. I also think that it's important, a very important recommendation was that we need, instead of fearing also, which is understandable, what this new age of digitization can do to confidentiality and can do to data risks. But you also have to really look at it in a positive way and to say, okay, how can we actually use what a digital system can offer us in terms of security of data, and to make sure that you use it to the full extent of its possibilities. We have to re-examine workflows and existing systems to see where processes can be augmented through the use of a digital system. So really to refocus on all the different steps of case management to say, okay, where is the use of a certain tool appropriate? As we're doing, for example, now in CPIMS as well, we really look at, for example, the use of mobile. Is it appropriate? Where in the system can they actually use this? And of course, taking into consideration the different risks around this. But I think a lot of work can be done on really seeing how the system can be integrated into the different steps and phases of case management. It will also be interesting to use ICT to really work more with children. It needs to really be seen how appropriate this is and how we can make that most interesting and with the best outcomes for children and for quality of information and the quality of information that they can receive. Then make sure that we always establish mechanisms for user feedback, and to make sure that we are constantly adapting our technology to feedback that we get from users in the field. Then there is the recommendation really around using ICT to bring also agencies together. Using ICT comes with new exigences, how you say it, new needs, new requirements for data sharing protocols, for information sharing. It comes with new risks. So it's very important that all agencies work together, and it's already happening now that we are working a lot together to really see, okay, what are the different, how can we standardize actually our approach around this and make sure that we also have the same message to end users in the field around this. As I already mentioned, so the research. Sorry.
So you mentioned user feedback.
Yeah.
How would you do that?
Well, for example, what we're doing now, I mean, it's part of the M&E system. So basically, we get regular feedback from the users. So either it will be maybe they're facing problems with their system, so we know all the different issues that are coming in. So based on those issues, we know also what kind of enhancements we would need to do. But we also ask them concretely for feedback on what they think the system needs to improve and to make it more user-friendly or more efficient for their work.
And was there any comparison in your research between, I don't know, like having a button or an email address for sending feedback or running a survey, for example, or like different means of doing user feedback?
No, this was not part of that. This was
Okay.
not part of this research. No, but it is. It's something that, at least for CPIMS plus, I can say that it's something that we're looking into, how to make this a more automatic, automatic system. For example, now you can actually go to a certain through the system. It can take you to a certain page where you can actually put in your feedback, and it can be a bug, or it can be a comment, or it can be a request for improvement. But this is something that is a work in progress. But we are, for the moment, already, and all the developments are happening. We take into consideration these all the feedback that we have received so far. So, and the last recommendations for next step was really to use this research, as I mentioned before. So the theory of change that was proposed, as well as the ICT framework. So really, it takes you through each step and different questions you can ask yourself when you want to use ICT in your programming, and to use this research really as a basis for future interventions or future research. Lastly, I did want to go into a little bit to what the ongoing. I think I did. This is not the latest one. This presentation, but it doesn't matter. I will mention it. It was just 2 points, I think, that were there. It's okay. Don't worry. Really, don't worry. As we are working, I don't know if all of you have heard of Primero and the CPIMS Plus. No. So CPIMS stands for Child Protection Information Management System, and the IA, the interagency CPIMS Plus, was developed since 2005 by a joint collaboration between UNICEF, Save the Children, and IRC, to set up an information management system because of the need of interagency collaboration, information sharing, having more possibilities to actually analyze the data, report on the data, etc. So that was developed in 2005, and since 2013 there is now Primero, that's the development of Primero that's underway. And basically Primero has different modules. So one is CPIMS Plus, which is the enhanced version of the IA CPIMS, but it also is a platform for the GBV IMS as well as the MRM IMS, so the monitoring and reporting mechanism, which is mainly used by UNICEF. But it was really
the gender-based
violence IMS. Sorry, yeah. It's really to pool the resources, because all these different types of programming, they all needed to have either update or upgrade their systems or develop one. So it was decided to pool those together into one software platform. Just a quick introduction. I work mainly on the CPIMS Plus module of the system. So I just wanted to give a few links to actual work that we're doing in the field. We will now start for the first time with Primero. So the CPIMS Plus model of Primero, we developed a mobile component. So this is a mobile component for FTR and case management integrated into one application. And we're going to introduce it now for the first time in Kakuma in Kenya, in the Kakuma refugee camp. So this is something that we're working on now, is to set up also this baseline of how we're actually going to evaluate the impact of using this, but also really to phase it slowly. I don't want to just put a mobile phone in the hands of a social worker and say, okay, now you can sit with your beneficiary, with the child, and use it. It has to be very, very properly phased out. So really to use it for to keep using paper-based, but then to use the mobile to rapidly be able to introduce the data, and then to look little by little to using the mobile directly in the interaction with the child. Related to this also, there's an interesting development with the Global Case Management Task Force. Actually, it's led by Terre des Hommes. It's the development of a child-friendly app, so an app that will be participatory, a mobile app. We're still really on the first phases of the discussion around this, but it's really to see how we can make the app actually something that will that the social worker can use in her work and her engagement with the child, that will actually maybe even help building a relationship with the child in the beginning. But we still need to really we're going to take that slow and really decide on which aspects we're going to focus our attention, and to make sure also that's really properly evaluated for the impact. As I said, with Primero CPMS Plus, we also ensure regular feedback from the field, and we always use it to develop, to influence the developments of the system. We've been doing a lot of work with UNHCR. We've been on several joint missions where we work really on having joint data protection impact assessments. So really to see, okay, what are the different risks to using this new system. In this case, it's the CPMS Plus in refugee contexts. What are the risks actually of using this, and how can we make sure that these risks are limited and mitigated, and to work really on joint data sharing agreements and joint data protection protocols. So it's a work in progress, but it's been a very, very positive collaboration. And maybe you can actually say something more about that, but there's also work being done on the interoperability between Progress and CPMS Plus. There is a specific working group, the Primero Progress working group, that really looks into all these issues, the technical issues, and then of course also we have to look at the types of data and how this data can be shared. But so these are the main links. So of course we try to use all the recommendations from the research and incorporate them into our work, and we hope to get more funding to continue this joint research. That was my presentation for today. So please let me know if there are any questions.
I just wanted to add the definition that you give in the interagency group to case management, which is the process of helping individuals, without talking about children in particular, although it's the case for CPIMS. So
but not only. So
not only. The process, and their families also. The process of helping individuals through direct social work type support and information management. So we're talking about the digital aspects linked to this.
Thank you.
Take questions if you have some now, or...
And please also, Janis, if you had anything to add.
I would just add, I think for me what was interesting about this research from UNHCR's perspective, because I think as you said, it's a lot of it was qualitative, it was limited in scope, but it was in a way the first of its kind in our field, as we noticed from the review. So I see it really as a kind of a starting point of basically, and I think maybe this relates to something that you're going to talk about as well, is how do we have a framework against which we can benchmark ourselves when we're looking at these digital systems. So all kind of agreeing together that if you have a digital system for case management with children, it needs to make things go faster. It needs to make sure that children get things quicker, more efficiently, that the more children in greater need receive things first. So at least I think for me the main takeaway was agreeing on those specific outcomes, and then identifying some of the things that have to happen in order for that to actually work. So interoperability was one, having the right infrastructure was another, people who are able to use technology, who are kind of technology literate, or else finding the technology that works for people depending on their levels. And so I think it was a good piece to kind of set our thinking in that way, but now really it will be about implementing that and measuring it in the future.
Yeah, it's really important that we make sure that this research doesn't remain in the closet, because it does have. You can operationalize this research, and I think a lot of aspects are really going to be interesting, and if we make sure that it's used also across agencies, then for future research it will be very, very beneficial, I think. So, yeah.
I hope you're planning a working group on how to make it operational as soon as possible and see what would be the first steps and the quick wins that we can take from it.
Yeah.
Yeah, I'm curious to interagency. I know not that much about the case management or something, but do you also share information about the cases within organizations?
Between organizations,
yeah.
Yes.
And how do you approach with data protection and
Well, it depends really. I mean, the main principle is that you share information on a need-to-know basis.
Mhm.
So you actually share information because it will improve or provide access to services for children. So this, we try to define that in what we call information sharing protocols. So in these protocols, it's defined what information is shared, with whom it's shared, when it's shared, and how it's shared between the agencies. So this is a lengthy, can be a too lengthy process. It's something we're working on also to make that simpler and more accessible. This is what we're, for example, with UNHCR, to have this joint data sharing agreement that we can use as a standard.
It's also worth mentioning that consent is always the preferred legitimate basis for any sharing of information. With children, there's an additional requirement, which is that it is in the best interests of the child. So.
And that they give their agreement also.
okay.
But that is something that we need to.
Agreement or
From the children.
Depending on the age
and the decision being made. So if you're sharing information for one purpose, the decision might be made at a different level than another purpose. So.
But even also, of course, getting informed consent from a child is also not easy, and that's something that we're working on. Even for making, for example, a child-friendly app, maybe we can use that to inform a child better in terms of what he or she is consenting to. It's just an idea, it's not something we have made concrete at all, but I think something like that, because for a child it's very hard to understand, and also consent can take almost a whole session just to explain it to a child, and the child doesn't even know why somebody's talking to him or to her.
And I think that's one, in terms of the introduction of this session, obtaining consent is definitely a human process. And in terms of when we were looking at our software requirements, we were looking at how do we make sure that consent is there. There's a lot of fields in terms of what information do people consent to share, but at the end of the day, there's nothing that stops you as a caseworker of just ticking the boxes. And how did you really inform that person? Do they really understand what's going to be done with their data? Especially considering maybe some of these people have never seen a computer before. So how do you really get that process? Or I think that at the end of the day, that is only a human thing, is kind of really looking at someone and saying, okay, yes, they understand. Then we can just record it in a database. But that's, for now anyway, it's not something that can be replaced by technology.
No, only the process maybe could be improved.
You
but
can add
not
some safeguards at least.
But not the.
You can take away some of the human error, so at least that the computer will remember this person said they don't want to share their information with that particular party, whereas Janis might forget.
Yeah, exactly. You had a question also?
So my name is Rewa Maktabi. I'm the Child Protection M&E Officer for IRC. So I just want to add something to what you asked about the consent for the child. As you said, it does differ depending on the age of the child, but also depending on the case. So depending on if it's a high-risk case or a low-risk case, that also, it affects if you're able to disclose any information about the case. And also you do need parental consent. So if you think that it's a very high-risk case, then for IRC specifically, even if we don't get consent from the child, we have the right to actually take the step to see what is in the best interest of the child and of the case. That's if it's a high-risk case. But I have a question for you. So in our program right now, we're actually in the process of rolling out CPIMS.
Yeah.
Okay.
I know.
So I just wanted to ask, based on your research, how can you facilitate the transition into CPIMS? If so, we're very limited now with the protection of our data and our like digitalizing our data. So I just want to see like how can we transition into CPIMS in the best way possible that doesn't really affect a lot of our current data and program.
You mean the current IA-CPIMS system? So you're talking about data migration?
Yes.
Mainly? Well, the data migration, it's very much technically possible. I mean, there's no, but it is a lengthy process because you do have to go through each and every value that you have in your old system, and you have to map it to the new system and make sure that all that data is brought into the new system, which then needs to be verified also. So it's possible. We are still learning how to make that process as easy as possible. We're going to do it now in Jordan, as well as in Kakuma in the coming month or two, I would say. So we'll have also lessons learned based on these two rollouts that will help definitely for IRC also to make that more systematized, and for an agency like IRC to make sure that they are preparing themselves for this transition before IRC comes to actually do the transition. So.
I think there's also, I mean, it is a very different world in terms of data protection since 2006, and it's also important in any migration to check that the data that you are migrating is accurate, is still accurate, which is a big problem we've had with some databases. And also if your new system does anything significantly different from what the old system does, you'd have to check that that wasn't going to be something that the person who gave you the information never intended to happen. So if there was any kind of automatic sharing that didn't happen before that would happen with the new system, and the person never originally agreed to that, you'd have to kind of check on those things. So one of the things that we're, I think, trying to work on is making sure that when we do migrate data, it's up to date, and these are cases that are active. These are children that we're seeing on a regular basis, who we can inform about any changes that are taking place.
That's actually been a very positive side effect almost of introducing a new system. I mean, in Jordan as well as in Kakuma, they're going to make sure that all the cases that need to be closed are closed, that, as Janis said, the information that's in the cases is accurate and is actually going to be, that you're only migrating actually data that's the quality data.
I think, and this is something actually that I think really came out of the research as well, and that we're finding in terms of the work we're doing on implementing these systems, is your system is only as good as your information management system, your digital system is only as good as your human system. So if your human system is disorganized and doesn't work well and is inefficient, then your digital system is not going to fix that. In fact, it will probably become disorganized and inefficient, and you'll have problems with your data and all of that. So you can't have one without the other. And I think the friend or foe question is kind of very much depending on the circumstances.
And it can also be a way for management to sort of protect themselves, because they've set it up in the tool, so it's sort of the social worker's responsibility if, for example, the consent has been ticked when the child hasn't been properly informed, I suppose.
Yeah, absolutely.
Janis,
yes?
your
Okay.
turn.
And that segues nicely. So basically, I'm going to talk a little bit today about how we use digital case management tools in UNHCR, so the UN Refugee Agency. Since we're not many, I can just ask you, how much do you know already about UNHCR's protection case management work? A little bit, not a lot. Okay, I'll give you the short version. And I'm speaking, of course, so as I said, my name is Janis. I'm speaking from a protection point of view, so I'm from the Division of International Protection. The digital system itself lives across several divisions, so I'm talking about it from the protection caseworker, social worker point of view. In UNHCR, we provide international protection for persons of concern, so especially refugees, stateless people, also internally displaced people. The system I'm going to talk about now is specifically, at the moment, for refugees. UNHCR has a special role in providing protection for refugees. Essentially, if states are not providing refugee status, that's something that UNHCR provides directly. We also have a supervisory role in terms of international protection for refugees. So even where a state is providing protection for refugees, UNHCR also has a role in making sure that they're accessing all of the rights that they are entitled to in that particular place. And they can approach us at any time to kind of talk about what issues they have. We also have a role globally in terms of providing solutions. So some of the work that is well known that we do, for example, is around refugee resettlement. So taking people from one country, if they're not able to find any kind of durable solution in that country, bringing them to another country. Those are kind of some of the things that the digital systems that we have were set up to enable. Documentation is another big one. So you can see in the photo here, this is someone who has been registered in the digital system, and they've been given a printout of their registration, and they're being explained what's on there. That's a very basic kind of form of documentation. In other operations, we kind of produce those as ID cards. We can provide or support the provision of convention travel documents. So there's a whole bunch of different aspects of protection, and we really do, when we look at refugee protection, we look at making sure that people have access to their rights from child protection, protection from violence, exploitation, abuse, all the way through to their access to documentation, their access to durable solutions. So it's quite a big mandate and you can imagine that when that's what's on your table for protection, that's a lot of different parts of a person, it's a lot of different information, all that stuff. So the UNHCR has been in existence for quite a long time, set up with the 1951 convention. Before that, there was a predecessor organization, so this kind of casework for refugees has been going on for a long time. I was actually saying earlier, recently I went down to our UNHCR archives and I found case files as old as the 1920s from the predecessor organization. And so this was where people, European refugees following the different world wars were being registered and looking at what kind of assistance and protection they were entitled to. And it was very interesting because in terms of the human side of it, a lot of the information that was being recorded is very much the same as what's being recorded now and the kind of processes there. So in that way, the paper side of things, I think, hasn't necessarily changed that much. But what is changing is maybe the digital side of it. So for UNHCR, our digital case management journey really started with the Kosovo crisis. The Kosovo crisis didn't start in 2003, but it was in 2003 that we introduced the first version of what we call Progress. So that stands for Global Profile Registration System. And the name is actually, we never even use the full name. We just call it Progress because actually the name doesn't even really reflect what it does anymore. Originally, it was literally about producing documentation for Kosovan refugees. So as people were coming over, most of them did not have any identity documents. We didn't know who all of them were, and they needed to have ID cards. So through a partnership with Microsoft, you can see this really, really old school, massive briefcase of a thing. And we had about 100 of those, and that's how digital registration and case management started for UNHCR. So from those initial 100 kits and the Kosovan crisis, we are now at 7.2 million individuals registered in Progress in 97 different countries. So it's expanded quite significantly. So this is the picture that you get in 2016. This is, I think from the Kosovan crisis to the Syrian crisis. The Syrian crisis is probably where we have the highest quality of registration and digital case management data going on. So you can see this has full biometrics being taken for individuals. The software is on its third version, so it's much more sophisticated as well. And it records basically, it doesn't just issue identity documents, it records details about a huge variety of aspects of a person's life. So once you have a full individual registration, we have information on where you're from, who your relatives are, what you do, where you went to school, the places your different addresses where you've lived, what documents you have, what your occupation is, what your skills are, where you've worked, what assistance you've received. In terms of our protection case management, we have details on refugee status determination. We have details on resettlement, if there is any resettlement going on. We have details on child protection. We have very limited details on STBV as well. Other vulnerabilities, other assistance aspects. Yes?
Is this similar to RICE?
No. So RICE is a separate, RICE is for those who don't know it, it's an online system that tracks assistance. So RICE is fed by Progress Information. It's just an online assistance interface so that organizations who want to basically log that they've given food or cash or whatever item can log that on an online system. But without this registration, RICE has nothing to pull from, basically. So it all starts here. And in the corner you can't see it very well actually, but that's just kind of, that's Brad Pitt's registration page. But you can see it's in terms of the software. But anyway, so you can kind of just see, I guess, a little bit the journey there from initially a quite limited protection function. It was literally just the identity of a person, essentially, to now a much more comprehensive case management. However, it's not complete in a lot of ways. So what happened, we added bits and pieces over many years. And so now, for example, if you're working on resettlement, which is something that typically only really UNHCR staff and staff from the governments who are receiving refugees have a lot of interaction with, you can record full resettlement forms in progress. So you can record interview details. It's very extensive, the amount of information you can put in. For child protection, on the other hand, you can only record certain events, basically. So you can track the progress of a case and you can put in comments, but you can't record all of your interview details, you can't record very detailed information that, for example, the CPIMS does record. The reasons for that were essentially around the limitations of the system. So the older system didn't give us enough confidentiality that we would feel very comfortable putting that kind of details in, for one thing. For resettlement, it's restricted by the user, so it was only resettlement users looking at that, and they would send the forms off to the other governments. For the child protection aspects, though, because there are so many people working in protection, and we couldn't restrict it to say just Janis can see Janis's cases, we didn't really feel comfortable with that level of functionality, so we kept it at case tracking. So basically, I think, it worked pretty well. I would also say between Kosovo and Syria, there's still a lot of other stuff going in between. I think the Jordan operation, Lebanon, those kind of operations really have like the Rolls Royce of registration setups. Whereas you also still have a lot of operations who still need to use paper to a certain extent. So you can see up here in this top corner, they're giving out bracelets and fixing tokens. So that's when people just arrive. The first records we get is, basically a name, how many people are there, and they get bracelets so that we have the numbers, and then later on we can record more details. You can see in this one, this will be an individual level registration, but it's all still happening on paper. So again, they're recording very basic details, they're putting it on paper. All of that then needs to be repeated later when it gets entered. And I think this is one where from the Rolls Royce version to what actually happens in the field, sometimes our digital systems are not necessarily helping us out because we end up having to repeat processes on paper and then put the information in somewhere else. How do we make sure that things don't get lost in between? There's also, we still in UNHCR, definitely we still use our paper files to a great extent. So your digital system provides you a really good kind of snapshot of what's going on and where things are in the process, but you still need to pull out your paper file to really know all of the details. As a caseworker myself, I'm not sure if I'll ever feel entirely comfortable not having a paper file. Maybe I'm just too old for this, I don't know. But I think that's kind of the direction we're going anyway, is at least, we equally have had offices where we've had fires and we've lost a lot of paper files, and all that we're left with is the bare bones that are in the digital system, so something to think about. Anyway, so as I said, with version 3, Progress version 3, we have come a long way, and I think we've learned a lot on the way. We're about to introduce, well actually we've already started introducing the latest version of the database, which is what I'm going to talk about next. But before I do that, I wanted to kind of give you an idea of where we are now, what our thinking is, what we've learned from this, I guess, 13 years of progress. The first thing, as I said, with 7.2 million records, is that it really needs institutional support, and that includes staffing. So our database has a core team in headquarters, which is quite a big team. They're now mostly based in Copenhagen. I think it's about like 15, 20 people who support the Progress database. And in that team, there's people who work much more on the software side of things. There's people who work much more on the human side of things. So what is the training that people need in order to be able to enter things in here? What does all of this mean? When they ask you this question, country of origin, how do you interpret that? So all of that kind of training element and procedural element as well. How do you set up centers in terms of collecting the data, in terms of verifying the data, ensuring accuracy, all of that stuff. And it requires not only people to support it in terms of fix something when something goes wrong, but actually also in terms of thinking about how does this fit with what we're doing? What is the policy side of this in terms of protection? And that's, I think, been a really interesting learning curve for me, actually, as well, in terms of working with my IT colleagues and my colleagues who are, focused on kind of software development and looking at it from the protection side and saying, okay, this is how this needs to work. Here's the actual possibilities of the software. Where do we find the compromise? The other thing we've learned about version 3 is, it is a continuous process. So we already had version 3 of Progress in 2006. I think that was actually when it was either 2005 or 2006 it was first rolled out. So that's exactly 10 years. It's changed a lot though in between. We keep having to add stuff, basically. Add stuff, fix stuff. So once you have a piece of software, it's never done. And you always have to be listening to what the feedback is that you're getting from the users in the field to say, okay, we need to add this functionality, we need to tweak this, we need to add values here. And that's also takes a lot of work. The number of updates that are coming for version 3 it's a lot all the time.
Resources.
Absolutely. The other thing is, of course, updating your data. So one thing that we do in UNHCR is we do verification exercises for the population so that we try and make sure that we are regularly getting the most accurate data. We also now have continuous registration. So if you're managing a case and you're seeing a person regularly, then it's easier for you to kind of enter details in. But otherwise, you might not have a regular contact with someone, but they still might change address, or something might be very different about their situation from the last time you saw them. If you don't have a way of keeping that up to date and informing them that, when they do change their address, they can let you know and you can update it, then your data will become out of date and you won't be able to use it for effective case management. So when you actually identify that you need to talk to this person because there's a risk that might affect them or something going on, you don't know where they are and you can't reach them because you don't have those details. So the policy guidance, supervision and support I mentioned already in terms of the support for the database, and that's also the IT support, I think. But for protection staff as well is really important. I think one of the things we noticed in some countries was that we had this great database and none of the protection staff were using it because they didn't know how and they didn't really know what it meant, and they were kind of, they were more of the older school people like me who like their paper files, and it takes a really education also in terms of getting protection people to understand how to use the different functions of the software.
They're usually very scared of technology.
Yes, exactly. So it's a lot of maintenance also from our side, and just kind of informing our, and for me especially child protection SWV workers on what they need to do with this system, how they need to interact with it, and that's an investment really. The other thing I think is the integration between the teams. So that for me is something that I've learned a lot. I've always thought about it from just a protection perspective. Like, this is case management, it's protection. When you have a digital system, it's not just yours. It belongs to a lot of different people in the organization, and having the buy-in from your IT colleagues in terms of having computers that work, having internet installed, having kind of that infrastructure there. having the backups done, where are you keeping this information? Is it secure? So, all of the stuff on the IT side, plus in terms of the kind of the software side, the information management, data analysis side, all of those colleagues there, and then also your caseworkers, and getting all of them to talk to each other and work together is harder than you might think, especially because they don't always speak the same language or have the same priorities. And so that's been something that I think we've worked on over a long period of time. And I think it comes back in a way to the first point, which is really that institutional support. So at the end of the day for UNHCR, Progress is our institutional tool. That's what we use. If you want to work for us in an operation that uses this tool, then you're going to have to figure it out. And without kind of that high level of support to say, this is what we're going to use and we're going to make it work. Which leads to, again, the second point, kind of saying we're going to keep doing this, we're going to keep investing it, we're going to keep updating it. I don't think these kind of big tools work without that level of commitment, basically. So the last point then is on monitoring. I think this has been a really important lesson learned from version 3, and one of the kind of main reasons that we're moving things forward as well. We found that protection monitoring and protection case management go together. It's actually something I think that the gender-based violence information management system has taught us a lot on. The gender-based violence information management system basically collects information about sexual and gender-based violence incidents and feeds that back into programming. So it gives you that kind of aggregate data which tells you, okay, so in the last 3 months we've seen an increase in cases of child marriage. And they're not necessarily getting the responses that they need. They're not, for example, getting a medical response, or they're not getting a legal response. And that tells us then how we need to adjust the programming that we're doing. Do we need more caseworkers with a legal background? Do we need to invest in additional health services around reproductive health for adolescents, for example? So we've really noticed that makes a huge difference, and that if we're not kind of harnessing that type of information from case management, then we won't always be getting people what they need when they need it, essentially. So I think those are kind of like our big, well, I say they're certainly my big takeaways from a protection perspective on Progress version 3. So from that, where are we going? We're going to Progress version 4, which is officially called Progress in Partnership. There you go, you have a nice logo. And why is it called that? It's because the biggest change is that it is accessible to partners. So I didn't mention this about version 3, but for a variety of reasons, only UNHCR staff have access to the current version of Progress. That's basically because, as I mentioned at the beginning, this is a database that we use to grant refugee status, that we use to issue documents. So the integrity of the information in the database has always been a really big priority for us. And essentially that meant that we, as a policy decision, said, well, we can only have our own staff inputting this information because we as an organization have to stand behind every line in here. With the new version, we've basically realized that, and this was, I think, the main feedback that we got from protection caseworkers on the ground, was that actually, in terms of providing effective services to people, that doesn't work so well. We really need to be able to get information from partners. We need to be managing cases together, because a lot of, for example, in child protection, SGBV, in assistance, there's a lot of dimensions of protection that are dealt with primarily by caseworkers in other organizations, whether they're governments, NGOs, whatever it is. And if we don't make our system accessible to them, then they can't have really important information that they need, even if someone has consented to share it. And they also can't flag back things to us. So that if a child, for example, is working primarily with a local NGO, and it's that NGO that has the social worker who sees them every day, it's much easier for that social worker to just update their details in the system rather than having to take them to come see UNHCR or send their details in an email that might not be very secure, or those type of things. So that's the biggest change, I think, and that was the number one requirement for us when we decided to move to the next version of the system. It also, though, I mean, it does also raise, data protection challenges, and that's something we've really noticed in designing it, is so who can see what? And when you collect, I mean, now we're talking about having a lot of information about people, all the information I mentioned previously, plus, let's say, as a child protection partner, you're entering, really in-depth details about a child's history of separation, potentially their experience of abuse. How do we make sure that only the people who need to see that are going to see that? It means a lot of restrictions in terms of not only what partners can see of the data that UNHCR collects, but also the other way around. And that's also quite interesting, between government as well and UNHCR. So the operationalizing our principles in terms of protection and data protection has been a very interesting challenge. How am I doing for time?
Are you done, or are
No.
you? No.
But I need to go faster.
Yes.
Okay. I can see you looking at me. I think that I will keep very briefly just to say so. The other main difference is that we're really looking at holistic protection case management. So Progress version 4 will have modules for all aspects, from refugee status determination, child protection, sexual and gender-based violence, assistance, cash, you name it, we got it. Almost a bit too much sometimes. But the important thing, though, is that it follows a workflow. And I think that's the other thing that we really heard from protection workers on the ground, is that it's not okay for the system to change the way they do their work. The system needs to reflect the way they do their work. And what we've learned also is that if it doesn't reflect the way they work, then they don't use it. So that kind of process flow was very important to maintain.
Sorry, how did you do that? Because I'm assuming you get some differences in the way people work. So, I mean, when I look at progress, it's scope, like it's you use it in different countries, context, and different crises, etc. My first guess would be that it's actually imposing. It's actually getting people to work in a certain way, and not the other way around.
I think it's probably a little bit of a balance. So the truth is that there are some standardized workflows. Certainly, for example, when it comes to refugee status determination, you can't just do it however you want. You have to go through certain steps. But that's actually true of most case management processes. The steps are very similar. So it's just about creating basically flexible enough entry forms so that the information that is relevant to a context can all be reflected. But then the steps, and that's the workflow, it's actually pretty easy.
Because people don't update the system during the interviews, right? You would take notes and then enter.
I mean, that's going to be one of the big things to see in the future. Certainly, that's how we do it, how we recommend doing it now. So you would take your notes. You can use your own paper forms if you use forms, whatever it is you're using. For example, when I do best interest assessments with children, I don't use any forms. Sometimes I don't take notes. I will do it afterwards, just because that's my way of working. For registration, they actually do it with the computer in front of them, but that's a very different process. So I think, again, that's one of the things that we can't automate. It's a social worker also has to kind of use their own judgment as to when it's okay to take notes, when they might use an application, when they might use a computer.
That's what I was saying also about the mobile application, to see really how, I mean, depends also on the aptitude and what the social worker, him or herself, actually feels comfortable using, and that coupled with what we actually would recommend as a process.
Okay.
But yeah, I think it's interesting to add to that these kind of digital systems can also encourage good practices. So I think it goes both ways, and I think it's actually a big opportunity that we have to make sure that what we at global level kind of decide on best practices, that trickles down through some kind of a digital case management system to say, okay, this is actually the agreed way of working. So I think that's actually an advantage also of.
I think it's a big question that Terre is also asking themselves. It's the big question of the time.
Yeah. Exactly.
Okay, I'll quickly wrap up. So the other big changes, obviously, this is going to be a centralized and web-based database. So all the information will be at some point kind of linked together, basically. it's also an online system. And we did a bit of a survey to look at how many of our locations have connectivity. Surprisingly, the vast majority of them do have some level of connectivity. But nevertheless, basically from the IT side, which is where that engagement comes in again, for them it means a huge investment in improving or delivering internet connectivity to places where we don't. Basically, the vision is that in the near future, there would be no need for an offline functionality because online would be everywhere. I don't know if that'll work, but that's the idea. It also facilitates a lot in terms of data analysis. I'll just make one point here, which is, this is where I always wonder to what extent we can rely on a database, basically, because with version 3 even, it's already helped us a lot. We do population profiling, which allows us to identify people for resettlement, for example, based on certain characteristics. So we say, looking at all of the population, we've analyzed them for X, Y, Z, B, C data points, and we think that therefore this list of 100 people will be prioritized for resettlement, and we can do that. With child protection, if you ask children, I always remember this, asking kids, in a community once, so, who are the children here who, most need help or most vulnerable? The answers came back as children who don't have anyone to love them, don't have love. So can a database tell you who is not loved? Not really. So that's, one of those things. I think there's a lot of potential in terms of moving to automated decision making, using data analysis.
There's also a question between quantitative data collection and qualitative data collection.
Exactly.
But you will always need a social worker. That's not even the question.
Exactly, yeah. So I think there's a lot that can be done in that way, and the balance, I think, is targeting, basically. So and I think this is the biggest challenge that we see for our caseworkers on the ground, is they have too many cases. And I think these types of systems can help you to narrow down and prioritize your caseload, basically. Although they can never, at the end of the day, really make those human decisions.
No, it can help. It can help give suggestions, but then those suggestions must always be able to be overridden by the human.
Yeah. That was all.
Thank you, Janis.
Sorry, I ramble.
So, Edmond,
Okay.
tell his own perspective.
So I'm not at all a protection specialist or social worker, so I will speak not necessarily on the technical side, but information management advisor, so I will speak more about my perspective rather than social one. Just to give you some briefly, I think we're a little bit running.
No, you have 15 good minutes.
15 minutes, okay. Just to give you a brief overview of where terrorism is, how we are using digital case management tools, or this kind of tools. We are working in the child protection area, so we are the main NGO in Switzerland working in child protection. We are a member of the Child Protection Working Group Case Management Task Force, so we were part of designing the case management guidelines or interagency. In majority of our delegation, we are implementing a case management component. It could be quite different, and we are mainly working in migration contexts, in child labor contexts, in juvenile justice too, so it's different contexts. We are working in emergency context, but also most of our operations are in development context. So that means we are not necessarily implementing by ourselves case management, but we are more trying to strengthen Ministry of Social Affairs or this kind of thing. So, of course, we're working in some refugee camps, this kind of things, but most of our work are really to support social ministry or local NGO. I just try to see her signs how many times, because I just recently joined Terre, so I have not the whole background of the organization, but I just see that the first development that we had for our digital case management started in 2006, so 10 years ago.
So many things started
yeah,
in
we
2006.
started in Albania so it's same, more or less same context in Albania, so 3 years later after UNHCR, but to digitize all the case management processes, and some of the tools that we developed even in 2008 are still more or less in place in Albania. We also try at the beginning of between 2011 and 2013 to have a standardized case management tool within the organization. So that means to have something which were able to fit all our needs, what was the context and what was the user. But the project has been stopped not for thematic or for protection reason, but more for technical issue. But this was one of our big experience. And science, this project stopped. We have different initiatives. So we are currently supporting Benin Ministry, Palestine Ministry, Albania Ministry to set up new case management system in the different country. And now, since I joined Terre, one of my tasks is to lead a benchmarking exercise to see if we are going again to the process of having a standardized tools for Terre, or perhaps having different tools, one for emergency, one for development. So this is we are just in the process of this benchmarking. In this process, the first step of this process, so we are conducting this study with CartONG, so with Maef, so you can add if you want some, you can add something. The first step was really to analyze what are the user needs. So we make the exercise to make some interview from our staff at different levels, so social worker, protection advisor, but also head of delegation, and at regional advisor and this kind of thing, in order to have the global view, also information management or local one, or how many people. And after that, we try to summarize all their needs. So we had something like 100 user experience, something like that. And so we let people add their own user experience, their own need. Oh, your battery is running low.
It's just...
I don't know where is it. And after we go through more or less a writing exercise where we ask the different user to write what was the most priority, what was the most important need for them. So just to give you a brief overview of the methodology. So one thing is that we have quite different perception of digital case management tools. There are still people who are seeing this like it's a danger, so it's something that say, it's technology, like social worker doesn't want to hear about that. They still want to say it's paper because I think it could be something which will destroy the relationship with the child or these kind of things. And you have also people who think that it's really a magic solution. It's what they need and it will solve all of their problems. Their management issues and everything. So, and of course you have people which are in the middle, but it's quite funny. And there are more and more, I have the feeling that you have more and more people who really think that having a new website or a new web application will solve all of their issues. And it's something that we need to fight a little bit again to explain. One important thing that we also see that there was a large diversity of need expectation. It was something that we didn't expect it. In fact, it was a bit a surprise to see that when we go through this writing exercise, there was very limited common trends. I don't know, emergency people who are focusing to be able to more for data protection issue because we are working in more conflict area, or perhaps to have the capacity to trace the donation, because when you are doing case management in emergency, sometimes there is a cash also which are writing, something like that. And development context were more focusing on the need to have a capacity to connect the database with the health database or this kind of thing. So it was also the needs that we see. It was also quite different from the type of user. Of course, EM guys were more focusing on having dashboards and having or the management was wanting to have data, this kind of things, and social worker was more focusing on having automatic reminders, this kind of things. And also we have also different needs regarding if the people have already used before a digital case management tool or not. So people who already use or we are already implementing something, they always want more feature. If somebody has already the basics, the core features, they always want more and more and more and more. So, but also, if you are looking at field needs, people are still thinking that we can develop tools that are fitting all of their needs. It's also something that we need to advocate at a little bit at the field level to explain that no, it will cost millions and millions to have something which embedded all of the need. So the main difference that we see when we are doing this need analysis, it's the issue to have something, a tool which is context oriented or something which is harmonized at the delegation, at the organization level or at the country level. So it's still something that we didn't decide for the moment. It's an issue which is still on the table. A very important one, so we discuss this a lot of time. If we need a tool which is more focusing on information management, so to have dashboard, to have data, to have something which helps the coordination, which helps the management of the project. At the opposite, it shouldn't be at the opposite, but to have something which is more helping the day-to-day work of the social worker. So that means to have a reminder to support them in the follow-up of the cases, to have, to promote the family approach, or to have tools which are allowing child participation, these kind of things. And it's still, of course, we can do both. Either we need to cover these both kind of needs, but it's still difficult to have both in one tool. You have, of course, people who really want to have a full digital, something which is only working on mobile, and they want to do everything on mobile. They want to stop to use paper, and people are still thinking that they need to keep paper on their work, but of course. The issue to have something which is open, to have a database which could be open to service provider when you are doing the referral system, or to link with a health database, this kind of thing, versus to have something which is only dedicated to television staff. It's also a big issue that we need to discuss. Child participation, it's also something that there is disagreement about that. So if a case management tool has to embed child participation feature, or it's just a question to have additional module that we can plug after in the case management system. So it's something that also there is, according to the different social workers, there is disagreement about that. The last one is the issues of I would say automatic risk calculation. We have some in some of country, we have some tools which are calculating some automatic risk, so saying, okay, this is high risk, middle risk, or low risk, and is it something that we want to promote or not? Or in any case, we want that the social worker should be able to overwrite what will be the automatic calculation, but it's still a subject of discussion regarding that. The other point that we have seen that there is a need to develop also some specific model. I don't know, there is for child migration, we need to have something which is very specific to be able to trace from where the child comes, what was his journey, these kind of things. If we are working with foster families, how we can follow them, and these kind of things. What we see also is that people are focusing in digital tools, so a lot of our delegation, a lot of my colleagues want to have a case management digital tools, but most of the time they forget also that the issue is not on the tool, but on the harmonization of the case management approach and on the capacity building of the social worker. We have there is, I can say that there is a trend to put effort on digital tool rather than perhaps case management approach, training of staff, trying to have case management process which are more harmonized and this kind of thing. And I think this is something that we should really keep in mind. Also regarding to data protection, I see that most of our concerns are more on the side of the NGO, so we know that we have a responsibility regarding data protection, that we should avoid that anybody can access to the information, these kind of things, but we are not really taking into consideration the final user perspective. So we speak about the consent and this kind of thing, but how really to, everybody has a box where we tick, okay, they give the consent, but how really can we explain that and take it into consideration? When preparing this roundtable, I just, at the beginning it was just for myself to understand more. I wanted to know how this kind of thing were working in developing country, and I just asked some friends who are working in social area in France. And I find quite interesting to see that there is still a huge debate even in France when there are dozens of tools which are deployed. You have very strong dedicated legislation, you have regulatory bodies like NIL or these kind of things, and this debate is still vigorous. And I just see that, for example, I don't know if it's the last one, but in April of this year, there was a call for boycott and demonstration from social workers in France, in one part of France, they were against a new software which are currently deployed, and so debate is very huge. It's not absolutely not scientific. I just go through some article, and according to what I read, so people more or less agree that having a digital tools in social work increase, of course, the efficiency. It provides the capacity to have a global picture, so for the management to have the data, to also to make visible the work, the social work, which is most of the time difficult to make visible because you have not so much figures behind that. It improves the coordination and collaborative teamwork when you have different psychologist, social worker, and it's also the social worker to have a greater insight. What are the observed issues in France is that professional secrecy is not respected. There is still a legal issue regarding that. In a lot of systems, the consent of the final user are not taken into consideration. So in France, there is a lot of database where we register information from people that we doesn't ask the consent.
It wasn't asked the consent? Okay.
Yeah, it's something with there is some legal in the moment regarding some database, and the respect of right to be forgotten is also not respecting. Of course, there is a lot of risk, and social worker are thinking that it's promote the humanization of social services. It's decreasing the time that you can dedicate it to people in need, because it's increasing the reporting burden. Even if every time we say that it should facilitating and save time, what we see in practice is at least when you are deploying a new tool, it's the opposite. It's creating more. You need to dedicate more time to your computer. There is a risk to have more automatized or mechanized of the social work, which is an important issue, because when you are informatize too much a process, it's becoming to be automatic. There is issue regarding the violation of privacy life, risk of fichage. I don't know how to say that in English, but fichage. There's the policing of the user.
Pinpointing a specific person.
The issue to still work with data which are frozen. Okay, you are doing your assessment, and even if the situation of the child is moving, you are not updating with data, and the decision that you are taken because you're just focusing on what is on your system, it's still based on frozen data. The risk to work more on, that people are concentrated on info on what is quantifiable, quantifiable, rather than the more the social work, and also there is the risk to use the data for predicative forecast. I don't know if you have that of the child at 5, you can say okay, it will be in 10 years it will become like that and something like that. What I found also interesting is that in some services where they really open the system to the final user, so that means a social worker know that one of their users can check what's written in their cases, it's improving a lot how the system was used, and it's providing a very good safeguard to the system. So for me, at my technical point of view, I have a lot of questions that I think need to be addressed. The first one, of course, is it really possible to digitalize a social work? Because when you discuss with social worker, every time they are telling you that each user is unique, its story is singular, and at my point of view, every time I want to put people in category because I need to work in category, to put in box and these kind of things. There is also a lot of issue regarding, I don't know how to measure the well-being. It's something, we have a lot of scale, we have a lot of different things like that, but every time we put it at the end in boxes, and it's very difficult for, I would like to be able to, when I informatize the process, to be able to take into consideration this nuance and this kind of thing was very hard. But, I need to, sorry. And
you need to also be able, actually, like, your beneficiaries also need to be able to evaluate your case management process, which also doesn't happen really so often.
So all the questions regarding the biases that we already discussed, how it's possible to use mobile phone when you are doing an assessment with a child. The issue regarding training or skill or the skill of the social worker. So if I need to refresh a little bit. No, I moved too fast.
All your fault, Janis. Okay.
Yeah, how to avoid that we are going to a too quantitative or too statistical approach of social work, or a too administrative approach. It's something that I really see in the field that, okay, we are just respecting the process and nobody's going a little bit beyond of what is written. And how regarding most of the protection issue we are working in country where there is no legislation or it's not implemented, there is no, or it's very powerless regulatory body, and you have no organization which are representing the final user or the social worker. So there is no really counter power regarding the tools that you are currently implementing. It's something I think it's very dangerous. And how to take into consideration the final user perspective. So I'll just put some ideas how to move forward regarding this question. So one of the solutions that we discussed with Terre, it was to develop a readiness tools that we already discussed with UNICEF, and we are in the process to link the different initiatives which are regarding this topic. So to be sure that before that we implemented a digital system that people have, it's in the right context. So of course to check donor harm issue. I don't know if you are implementing in a country such a tool where policy could have access to the system. It could be a big issue. To be sure that social worker understand what is case management, they are properly trained, they have ICT literacy and all this kind of things. So to avoid that the system that we put in place is not answering the need and it's creating more troubles than solution. I have also the feeling that we should very take care of that social workers are still involved in the development of their tools. I have the feeling that most of the time, especially on the field, that people feel dominated by the technology and say, okay, this is a system, how it works, I cannot change it, I can improve it. And I think it's very important that social worker keep the control of their tool and not me.
We really have to stop because ours are finished, we don't have a break now. So we need to change the setup of the room before the workshop.
Sorry, Edmond, one last sentence to conclude.
No, but for me, it's just to avoid that the tool is not an aid at itself, of course, but it's just to support the social work.
Okay. Well, thank you all, and perhaps during the pause a bit later on, if a few of you want to get together to continue and ask a few questions to our speaker beyond the questions that there have already been, feel free. Thank you.
Thank you.